All right, Dr. Wynn, I think we are live. All right, good afternoon. Today is August 6th, Friday. This is our Bariatric Friday, we call. It is 1:15. As we were expecting today, Dr. Irgau actually, he got stuck at St. Francis Hospital. And I had an emergency call to Dr. Wynn. And today was actually timely because she's in charge of the support group. And today our discussions around the support group. And before I start all of those, I just want to introduce myself. My name is Kemal Erkan. I'm the chairman of American Surgery Center, as well as United Medical ACO. And I have Dr. Gail Wynn with me today, and I'm going to ask her to introduce herself, and we'll start the program.
Thanks, Kemal. I am Gail Wynn. I am a general surgeon, bariatric surgeon. I've been one of the co-founders of the practice. We've been doing bariatric surgery for about 21 years. And I'm here to basically answer any questions or inform you about bariatric surgery and the importance of support groups.
All right. So, Dr. Wynn, usually what I do is I go through just to introduce our other surgeons as well. Dr. Irgau, the president of CHRIAS. Usually when I introduce you, I say she's the most expertise female surgeon in the United States in bariatrics. So I hope I'm not wrong with that, right? And then we have Dr. Mike Peters and Dr. Rahul Singh, Dr. George Ibrahim. We have 5 surgeons on the bariatric side, and we have Dr. Sachin Vaid on the colorectal side. We have 3 dietitians who work with our patients throughout the process, Fran, Amy, and Beth. Between our 5 surgeons, 6 surgeons, we have more than 10,000 cases done so far. In the last 3 years, it's more than 2,000 cases. Our program is MBSA QIP accredited center with the Blue Distinction Center Plus and Aetna Institute of Quality certification. So the MBSA QIP certification for the surgery center is important because that's one of a kind, because there are only 10 in the United States out of 9,300 surgery centers. So today, as we are making these pieces, smaller pieces for us, like we have our webinars, but then we have these events to discuss these topics. So today we are going to discuss the support group. So now let me actually, my mouse is not working now. Okay. Now, before the support group, Dr. Wynn, if you can just summarize the qualification for the bariatric surgery, and then we can kind of talk more about why patient needs more support and some of the other issues that they may have.
Sure. As far as who's a candidate for bariatric surgery, you have to basically have tried something in the past and have failed. And you have to have certain criteria to meet insurance requirements, like have a body mass index greater than 40 or a body mass index between 35 to 40 with medical problems like diabetes, high blood pressure, sleep apnea, heart disease. And we put you through a pretty thorough workup before surgery to see if you're a candidate. So we have you see a cardiologist, sometimes a pulmonologist. We have you undergo an endoscopy. You will meet multiple times with the bariatric surgeon. You'll get blood work, sometimes a chest x-ray, cardiac clearance, psychological clearance, and dietary counseling. And once you complete all that, which can take anywhere from 3 to 6 months, then we will schedule you for surgery. As far as the support group is important for before surgery as well as after surgery. And the reason why I say it's important is because before surgery, it's nice to come to support groups so that you can hear and listen to what people that have already had surgery have experienced. You're able to ask them multiple questions as well as see what their experience was. Last support group, people were asking like, how much pain did you have? How hard was it? What was your first month like after surgery? And all those are really beneficial so that you have a little bit better knowledge of what you're getting yourself into. The second important thing about the support group is for after surgery. Basically, it's a free hour to get any concerns, questions out on the table and get them answered. And not just by the surgeon. I'm usually the one that runs a support group, and it's a surgeon-run support group. So it's someone that's experienced, that has been doing bariatric surgery for several years. And then you also have a bunch of different people with different experiences, different backgrounds, different surgeries that can also attest to what their experience was and give you their suggestions. So it's a lot of ideas shared.
Dr. Wynn, I think one of the issues that our patients, not issue maybe, but one of the big changes our patients are going through, 90% of the patients, they lose 50% of their excess BMI, or excess body weight. And with that, this becomes a big life-changing event for them. So the adjustment of this eating habits, exercise, and all the other adjustments, it becomes a big challenge in a good way, right?
Correct.
So sharing this, and I know like I'm more on the pre-surgical side with the case conferences and getting the patients ready for the surgery side, which is already kind of like, it has its own problems with our patients because they need a lot of support. But after the surgery, they're kind of on their own with limited number of appointments. But this support group can substitute that extra need that they have, extra support that they have. But would that, like, why do they need to be in that setting? So just to kind of understand that a little bit better.
So the setting is good because you get in contact with other people that have had surgery as well. When I run support group, I try to keep it kind of fun and comfortable, meaning that if people don't want their name to be shown, then just put a nickname up. If you don't want your camera on because you're embarrassed or you don't want other people to know that you've had surgery, then keep your camera off. The main goal of support group is to feel comfortable in sharing your experiences, as well as feel comfortable in talking to the group. So that's it's basically, made for people to communicate with other people that have had surgery or are undergoing surgery.
So this is an exclusive group only for patients who have surgeries from our practice.
We have had people that have had surgery through Christiana come to our support group. We've also had people that have had surgery in other states come to our support group. It's not a requirement that they have surgery at our practice. It's basically open to everyone. Usually all they have to do is contact our practice and say they want to the link to the support group.
So what are the most questions do you get from the patients?
Most common questions during support group is how to get the protein in, ideas for getting more protein in. Many people ask about excess skin removal. Another thing that people ask about is what are other people's experiences as far as their first month after surgery.
Now, we discussed smoking and drinking after surgery in the last couple of sessions. Is that becoming a problem after the weight loss? Like, do you get a lot of questions around that?
It's not really something that I get a lot of questions about because most people know to keep that, to not smoke, as well as to limit alcohol after surgery. Main thing with alcohol is it's loaded with calories. So you want to not be drinking your calories. So we usually recommend, limiting alcohol or not drinking alcohol.
So now for those patients who are maybe, there are some patients who are not maybe losing enough weight after surgery. Do you see those patients also coming into the support group and benefiting from it?
Absolutely. Absolutely. Some of the patients that we see in support group have had surgery, years ago, and they're struggling, and they came back to support group to kind of refresh their minds, refresh their kind of spirit, and get involved again. And they're the ones that actually also contribute a lot, in that they have a lot of experience that they could contribute to the group. We have one patient that had, surgery back 20 years ago that comes to support group a lot to give a lot of advice. And she's actually doing great. But we do have a lot of people that struggle, and that's what we're there for, is to give you support and help you through.
That's excellent. So now our support group does have some rules, and then we do actually make sure that patients are aware of those. Be kind and courteous, no hate speech or bullying, no promotions or spam, and respect everyone's privacy. But the group that we are running on Tuesdays, first Tuesday of every month, 6 p.m., our marketing...
5 p.m.
5 p.m.?
Yes, 5 to 6.
5, we need to, I may have that wrong on our PowerPoint. We may need to update that. 5 p.m. Tuesday, first Tuesday of every month. So, so you are running it. We have a couple of our people are joining, and we want to make sure that every patient from us, they are getting emails from our marketing team. If they haven't signed up, because it's a private event, so we are not publishing the link, but they are getting the link directed to their email. So hopefully they are checking their spam folders. And also, I do want to go over a couple of the other things. I do go over this almost every week. Our patient satisfaction right now, we are still at 99.4%. Dr. Wynn, our weekly meetings, at the provider meetings, I do share some of our updates, but one of our projects that we have with these Bariatric Friday live events is having a couple of our patients joining us. So I sent about 75 letters to the patients who have given us positive reviews before, and a couple of them came back, and then they want to be part of the live session. And actually, one of them is your patient, or one or two of them actually are your patients. So I'm going to discuss those with you before actually we go with them. But it was extremely nice to see those patients willing to actually participate. So we are not paying them. So we are just asking them if they would like to participate and discuss and share their experience with us. Now, the almost close to 100% satisfaction is not something that's common in healthcare in the facility level. And our patients do take their time, and they actually go into the details, name our nurses, our staff members, our surgeons are fantastic. And we are extremely happy with that. And I know telemedicine is a big part of what we do these days to protect our patients and protect our staff at the same time, although we are utilizing the telemedicine in balance. So like we have many patients come in for in-person visits, and if it doesn't have to be in person, we do utilize telemedicine. And how's your experience so far with telemedicine?
Telemedicine has been excellent. I think it's really good because we have more follow-up. People don't have to take time off work. They don't have to drive in traffic. They basically, some people are coming in during their lunch break, going out to their cars to have a private visit with us. So it's really convenient for our patients, and it really does help with making our follow-ups a lot easier and helping people be more compliant with following up. As you know, follow-ups are really important because it really leads to success. If we have a good follow-up, we could detect if say you're not gaining, if you're gaining weight or if you're not losing weight the way you should, and we could provide appropriate counseling and mediation so that we can get you back on track. So it's really good to see people on a regular basis, and the telemed visits really make it possible and more convenient.
No, that's absolutely, and these days it's almost like this was kind of last minute when we reached out to you, and how quickly we were able to get on the video and then have this session. And if it was maybe 2 years ago, if we didn't have all these pandemic related issues, we wouldn't be as quick. But I think with the, there's always some silver lining in everything. So I think the pandemic did teach us to be more technologically better in some sense. So now we are having this meeting, and literally, like, you just learned about this 5 minutes before the session. And I do really appreciate that. But also, I'm pretty impressed how quickly we were able to do it without any difficulty. So I do want to go over a couple of our other events. So I just want to make sure that I didn't have this event, the support group event, at the wrong time. Do I have the support group here? No. So we need to add the support group here. So I was worried about the support group being at the wrong time, but these are our summary of our events, and we'll add the support group here. So next week we'll be back at the same time. We are posting these events on our YouTube channels and the social media channels. Now, Dr. Wynn, you are also the program director for our facility partner, St. Francis, for the bariatric program. And then we also do second and fourth Tuesday of every month. The webinar, I describe that more like full-fledged webinar, like the seminar. Like what we do here on Fridays is just the one topic, but in those webinars, we go through pretty much everything. It's more than an hour usually. And patients do benefit from joining those. Anything you want to add for those events?
They're very beneficial, especially if you're considering weight loss surgery, because it kind of gives you the facts of each of the surgeries, and it helps you kind of solidify your decision or even make a decision. So it helps you kind of learn about all the different surgeries that we do, and it's really up to you to decide which one is right for you based on that webinar.
I think getting that education prior to the surgery for the patients is really important, and getting that technical part of it is extremely crucial for the process. But we are here to help them. And again, thank you for joining me. And we'll be back next week. And next week we have the webinar. So that's the second Tuesday. And then Friday we have the live event. Dr. Wynn, thank you so much again. And
thank you.
See you guys soon. Thank you. Bye-bye.
Bye-bye.